Hi everybody, Dr. Daniel. Today I'm talking about let's work on these weekend migraine headaches. Well, weekends and migraines come together and they have triggers just like regular migraines during the week have triggers. And so if you could imagine the following scenario, this is how a weekend headache starts. Somebody's busy and working hard on a project. It goes on Monday, Tuesday, Wednesday, Thursday, Friday. They're staying up late, staying at the office a long period of time. They don't work out. They may miss a meal or two. Friday afternoon, they're through. The whole office goes to a Mexican restaurant to celebrate. An individual with migraine has a couple of margaritas and eats a ton of chips, but doesn't eat any food, goes home, stays up a little later than normally watching a movie. The next morning he gets up instead of at 7 like he usually does to go to work. And he hadn't gone to sleep at 10 or 11 like he usually did. He stayed up several hours. So his whole sleep-wake cycle is all kind of goofed up, So he doesn't have caffeine at the same time he normally does. He doesn't eat food at the same time. And he wakes up with a migraine headache. Plus he's also withdrawing from all the stress. And that's kind of the scenario that fits for weekend migraine headaches. So they have triggers just like regular migraines have triggers. So I'll read a list of the possible triggers that can come to cause migraines on the weekend. Oversleeping, alcohol, withdrawal from stress, heat, sun, workout headache, not eating regularly, caffeine withdrawal, humidity and dehydration. All right, with oversleeping. Well, why does oversleeping cause a migraine headache? Well, migraine is intimately related to the sleep-wake cycle that normal people have. And migraine persons have an intrinsically very special, sensitive brain that reacts to a lot of factors that normal brains don't react to, like motion. A lot of persons with migraine have motion sickness. They have sensitivity to light and get a headache, or they'll have a visual aura from flashing light. They're sensitive to sounds much more than normal people are, even olfaction. Some patients have told me they walk into a store where there are perfumes in there or different soaps, and they'll get a migraine headache right at that time. In fact, in my office, we had a big sign up saying, please don't have offensive odors here, and leave them off before you come in the office, because we have a lot of your patients here that can aggravate that. And then also, if we have a regular schedule of headache, it'll help them sleeping. It'll help us deal with the migraine and the headache. So normal schedule, let's just imagine for someone who goes to work at 9 in the morning, they'd go to bed around 10 or 11 at night, and then they get up at 7 or 8 in the morning and get ready to go to work. And so then if they should try to stay on that sleep-wake cycle all the time and don't take long naps, set an alarm clock so they can wake up in the morning and get going, all those things would be helpful in sorting out and keeping your biologic milestones all stable. But imagine if this individual sleeps later in the morning and gets up at 9 or so, something that can really set your cycle off. You want to keep the whole cycle sleep-wise steady for within about 30 minutes. Now, there's a lot of the migraine literature that's been written about sleep and migraine. It's a big subject, and standard textbooks on headache have traditionally noted this relationship for a long period of time. I'm just going to mention a couple of books that I've got access to. Diamond and Delasio, writing in their textbook, The Practicing Physician's Approach to Headache, in 1982, list oversleeping as a factor for migraine. Likewise, Dr. Saper, Michigan, writing in the textbook Handbook of Headache Management in 1999, states that, quote, sleep, too much or too little, is a potential provoking factor for migraine. Matthew, writing on headache and sleep and headache, the journal in 1987, stated, patients with chronic intractable, predominantly nocturnal headaches appear to have a high instance of sleep abnormalities compared with normal persons. Dr. Perlman, writing in 2002 in The Spectrum of Migraine, stated, quote, sleep patterns are often variable in an adolescent lifestyle, and sleep pattern changes often trigger or exacerbate migraine. Sleep deprivation, in this case, is a frequent trigger in children and adolescents. Regular sleep routines can reduce headache frequency. It'll happen to children, happen for adults as well. All right, so sleep has a powerful effect on migraine, and the rules for living it are as follows. They should set your sleep cycle, get up and go to bed same time every night, even through the weekend. do not have two separate sleep schedules. I used to hear this all the time. Patients would have a work schedule and then a weekend schedule where they'd mainly go to bed at night, later on Friday night and Saturday night, and they'd get up later on Saturday morning and Sunday morning. That's fertilizer for migraine, I'll tell you, boy. You try to get 7 or 8 hours sleep every night because that's kind of what's recommended. A person shouldn't watch TV, read, work, or listen to music or the radio in bed. Bed is for sleeping. Avoid oversleeping on Saturday morning or falling asleep for that seductive 2-hour nap after dinner on Sunday afternoon that can inculcate and build a migraine. If you develop a wake-up headache in the morning, like you get up at 7, a headache starts at 6, you might as well, of course you want to get them treat quickly, and you should have your medicine for migraine right at bedside so you can treat it quickly, but then just go ahead and stay up. Going back to sleep is not good for this. So the clinical pearl here is get up and go to bed at the same time every night to live with migraine. All right, the next thing is alcohol. Well, alcohol is well known to aggravate a migraine headache. I previously wrote a different blog article on, is alcohol a migraine trigger? You can find that on my website if you go there, drmigraine.com. And I'm going to just quote for that. Alcohol is commonly stated to be a trigger by many patients and accepted by many doctors. Control studies regarding consumption of alcohol triggering migraine are mostly positive for red wine. There are confusing results that limit the relationship with other forms of alcohol. Older, personal, non-scientific statements are not to be trusted as much as the newer, more carefully controlled scientific research. But one of the earliest references connecting migraine and alcohol was by Celsius, who lived between 25 BC and 50 AD. And he wrote, "The pain is contracted by drinking wine." How about that? Another earlier statement was made by Paul of Aegina, who lived 625-690 AD, who commented on the relationship between drinking wine and the occurrence of migraine. He stated that migraine you can get from drinking of the wine. It's been thought that certain chemicals in alcohol, such as tyramine and histamine, act on the brain and set up a migraine headache. And the other question is, well, then who educates about migraine and alcohol? Who's writing about this besides one blog writer myself? Well, American Headache Society, American Academy of Neurology are all writing about this. They have articles written about it. The National Headache Foundation has articles on this also. Now, the question of migraine related to foods is very confusing and uncertain. Again, I've got a blog article on that. But what do expert neurologists who write about migraine say? And I'm going to go back to Dr. Lance, who's a famous Australian neurologist who first wrote about ice pick headaches back in 1995. And I was able to hear Dr. Lance talk at Southwestern University Medical School 30 years ago on a talk on migraine. And he wrote in 1995, and I quote, "My patients with special food triggers have the same number of migraine attacks when they avoid triggers as before. The only thing on which they agreed is that alcohol precipitates attacks, specifically red wine. Otherwise, I think the question of dietary migraine is very suspect." There you go. That's Dr. Lance, expert. Clinical peril here is, if you get a headache from alcohol, watch out, especially red wine. Well, the next cause of the weekend headache thing is withdrawal from stress. This is also called the letdown headache, the weekend headache, Saturday morning headache, Sunday morning headache. These are migraines that come after stress. Well, withdrawal from stress is a migraine activating factor, which is just the opposite of applied stress, which is paradoxical in many ways. So the reaction here is poorly understood, but it may relate to a number of neurochemical changes that are happening in our brain and our body. If you can imagine somebody who is stressed all week long, he's stressed at work, he's stressed in his family, and so adrenaline is secreted by the pituitary gland, causes the adrenal glands to secrete adrenaline. And so adrenaline can cause in our brain vasoconstriction. It's like you're drinking caffeine or a drug that causes constriction like ergotamine can do it, and tyramine drugs can do that. Triptan drugs can do that. Then on the weekend, there's a freedom from stress, and so there's a decreased amount of secreted adrenaline, and it's like you're drinking coffee, and you quit drinking coffee on the weekend, then you can get up with a bad headache that can come at that time. So if on Sunday the patient oversleeps, the pituitary axis slows down a little bit, resulting in a bad migraine Sunday morning because of the adrenaline withdrawal and all that kind of thing. Also, for many Americans, Sunday can be a very stressful time because there's a lot of structure during the work week where we tend to put things off, and so there are a lot of arguments and family issues that are brought up on Sundays to be resolved. And then Sunday evening, your mind unconsciously anticipates the return to regular work schedules, and tension can come from that. So the clinical pearl here is keep stress levels steady and constant. All right, the next thing is heat, sun, workout headaches. The relationship of heat, sun, and working out with migraine hasn't been studied statistically as far as I know, and it's not in a lot of textbooks, but you'll see it all over the internet. If you Google sun headache and heat headache and migraine in the sun, you'll find articles and comments on that. So if you can imagine somebody who works out, who's out in the sun or gets hot, the face flushes, so all the little blood vessels in your face dilate, and the same thing is happening in the skull with the cerebral arteries. You get vasodilatation. I think that's part of the reason why you get a headache in that situation. It's because cerebral vasodilatation and activation of the trigeminal nerve are the very heart of a migraine headache, and that's what's happening in these situations. There could also be with working out or sun or heat, a slight increase in the core temperature of the body, which can aggravate headache from that. So the other thing you need to watch out there for a hot shower, sunlight glancing off a mirror, off of water, off of the symbol on the front of a car, like bright light coming off of that, many times can set off a migraine, particularly in persons with R that happens at that time. If you're going to work out and you get a workout headache, some people get some hard physical exercise if they get hot. So you might try to exercise in air conditioning or with a fan in front of you. And then if that still gives you a headache, you might try some kind of exercise or workout that doesn't cause you to get hot, like swimming. That's an example of that. Or some persons can take a Tylenol or an Advil or even half of a triptan dose, as long as they limit it to no more than 2 days a week so they don't get medication to ease headache before they exercise, and that'll help control that situation. Now, everybody knows that aerobic exercise is good for general health. It's something everybody's supposed to do, but it's especially good for migraine. It's also good for things that go along with migraine, that are comorbid with migraine, like depression, anxiety disorders, panic attack, and trouble sleeping, and all those kinds of things. The clinical pearl here is don't get too hot, avoid the sun, get good sunglasses, protect your eyes, and take a lukewarm bath that doesn't set off a migraine. Well, the next thing here is eating irregularly. So you're supposed to eat 3 meals a day. That's the way I grew up. That's what my mother always said, and you're supposed to do that. A lot of persons don't do that, especially young women, teenagers, young 20-year-old women, and come to my office will say that. And if you take a history from them, they are eating lunch at maybe noon, and they eat supper maybe 6 to 8 o'clock at night, and they don't eat any breakfast at all. And so I'll sometimes be didactic and teaching, and I'll go through and I'll say, well, if you ate, say, at 6 o'clock in the evening, you don't eat again the next day at lunch, your brain is going 18 hours without any kind of food in it. It's like you're driving a car without any gas in it. Now, they don't want to hear this, but I try to help them with these ideas. So in general, 3 meals a day is recommended. At least try to eat something for breakfast. And writers on the subject in the past have generally accepted that fasting can set off a headache. Living was this famous savant of neurology and migraine living in England in the 19th century, published a huge textbook on migraine, which is very still helpful now, 1793. And he said that fasting can be an aggravating factor for migraine. So the clinical pearl here is eat 3 meals a day and don't eat something for breakfast. The next subject is caffeine. Caffeine is a drug. It's addictive. It's listed as addictive by the American Psychiatry Association, the DSM-5. It's the #1 drug in America, according to the American Headache Society, that causes or aggravates medication overuse headache. Because a lot of folks will drink 2 or 3 cups of coffee a day, and then on top of that, they'll take analgesics like Tylenol, Advil, they'll take their triptans, maybe they'll take butalbital, or maybe an open narcotic. And so they're getting a lot of medications that can cause daily headaches, like medication overuse headache or chronic migraine, and they're not aware that 300 or 400 milligrams of caffeine can do the same thing. And the problem with caffeine is, since it's addictive, you don't drink it at the same time, you get a rebound from that and you get a headache. So if you're used to having your coffee intake 1 to 2 cups, maybe 4 cups in the morning at 7 o'clock before you go to work, and you don't have it on Saturday or Sunday morning till 10, that's give a rebound and that can give you a headache. Caffeine causes vasoconstriction, also like stress does, and you withdraw from that. The grocery store in Dallas where I live has a Starbucks outlet inside the store, and they have another one down the street on the same block. Now, Starbucks has a huge dose of caffeine in there. I have a list on this from this article on the web page, but one Starbucks 550 latte, 16 cc latte has 500 milligrams of caffeine in it, where the regular just non-gourmet coffee has 135 milligrams of caffeine. And you also see caffeine used by the fact that it brings other drugs into the body. So Excedrin mixes caffeine and caffeine together, and it's also used in other drugs. And way back in the past, before the pre-triptan era, when persons took Caffeine, that's one of the major drugs we use for treating acute therapy for migraine. That was caffeine and ergotamine, just to get the blood into your body. Clinical pearl here is caffeine is addictive. It commonly drives migraine headaches. And the last series of things I want to talk about are humidity and hydration. Well, humidity we can perceive in our body. It has to do with the amount of water that's in an environment. Boy, I remember those hot, humid, kind of blistering mornings in Galveston, Texas, where I lived 5 years in medical school and a year in internship. And I'll never forget it. I'll go back to Galveston for holidays, but I don't think I'd want to live there again because of the humidity problems. Also, hydration is important. That means you imbibe water in your body, and seniors and infants are very susceptible to that, but also migraine patients can be susceptible to it, and dehydration can be one of the factors that sets off a migraine. So if you're going to jog or work outside or exercise, have your water bottle there. I go to the YMCA and I see people all over where there are little situations where they're either stepping or on a treadmill. They have their water bottles there to be sure they don't get dehydrated. So avoid that. So the clinical pearl here is don't exercise or do yard work when it's too humid, and keep that water bottle nearby to avoid dehydration. So this is the end of the talk today. I hope you enjoyed it. Thanks for listening to it. Please click like down there, and I'll see you again on the next talk.